Beautiful. Well, can I officially welcome everybody as we're gathering to today's seminar. And have I got some wonderful power ladies for you to share your knowledge and energy with. So welcome, welcome, welcome. I'll introduce everyone shortly. But firstly, we're going to be talking about aged care information and tips for engaging with the community, with talking to the community. And you know, sometimes, I don't know if our esteemed panelists feel the same way, but sometimes it feels like we've been talking about this for 87 years and nothing's changed. But hopefully we're going to show you some good examples of what difference you can make and how we as an industry, so both people that are translating, interpreting, and also clients can work together. So by way of introduction, I'll just say that if anyone's got any questions, there's a Q&A box where you can pose your questions and we'll try and introduce them at the end of our webinar. This webinar is being recorded and we'll make it available on our social media channels. And we've got lots of amazing, interesting things for next year, but today we're going to be talking about aged care. So that's me. Everybody knows me. You don't need to know who I am. Well, you know, I'm the founder of Polaron, and this is actually our 20th year. So last month in November, we very quietly celebrated our 20th anniversary. So we've been around. But let me move on to our first guest, and that is Andrea. Lisa. So Lisa is from the Center for Cultural Diversity in Aging, and she delivers the objectives of partners in culturally appropriate care, which are PCACs. And I know that this is a structure, umbrella body for organizations that provide, you know, links and build relationships between culturally and linguistically diverse communities and providers. Previous to that, Lisa's worked for the and where she was the assistant of, Assistant Director for Inclusion Strategies. Okay, excellent. The next person I'd like to introduce you is Tonina Gucciardo-Massi. I've known Tonina for many years, and I think the first time I met you was when you were working for Carers Victoria, and we did a project in Polish together. So, you know, it's been a while since we met, but also you've worked, Tonina, within the industry for more than 30 years. And for the past 11, Tonina has been part of the Center for Cultural Diversity in Aging as a senior advisor. All right. I also wanted to introduce to you Gabby. Some of you have met Gabby in our previous seminars, but she's a translator and in the language pairs of English and Spanish. She's been a translator for a long time with us. We've worked together for about 16, 17 years. So, you know, a long, long time. It's a very fruitful and great relationship. Lastly, I'd like to introduce you to Marta Jarosz. And Marta's a new addition to Polaron. She's been with us for about, what, 3 months, maybe? And she's a project manager. Prior to joining Polaron, she's worked a lot in marketing and a few other bits and pieces, and those of you who have worked with her know how wonderful she is. So moving on and handing it over to Tonina and Lisa, I will ask Andrea to move the slides, but first we wanted to do welcome to country. So over to you ladies, Tonina and Lisa.
Thank you so much, Eva, for that introduction. And today we're going to be talking about accessing multilingual information from the Centre for Cultural Diversity and Aging in order to support your work in working in aged care settings as interpreters. So in terms of the acknowledgement to country, the Centre for Cultural Diversity and Aging acknowledges the traditional owners and custodians of country throughout Australia. We pay our respect to Aboriginal and Torres Strait Islander peoples, their ancestors and elders, both past, present and emerging, and acknowledge their continuing connection to land, sea and community. We'd like to extend that acknowledgement to any Aboriginal and Torres Strait Islander peoples listening to this presentation, and we hope our work contributes to fostering respect and recognition between cultures in Australia. Thank you, Matt. Andrea. So basically, the Centre for Cultural Diversity and Ageing, just to let you know, it is funded by the Department of Health, and it's part of a large national program called the Partners in Culturally Appropriate Care program. And the aims of the PCAC program, or PCAC for short, the aims of the PCAC program is to promote culturally inclusive care within Australian government aged care service providers. So we know that we have mainstream aged care providers, like residential care settings, home care providers, social support groups, etc. But not all of them, I guess, well, some people need extra support in supporting culturally and linguistically diverse consumers, their families, advocates and carers. So the Centre for Cultural Diversity and Ageing's broad vision is to ensure that all providers that all consumers are experiencing accessible, inclusive care in aged care. And what we do at the centre is we build the capacity and capability of aged care providers to deliver services that are welcoming, accessible and inclusive. And the way we do that is through diversity coaching and advice to aged care providers, capacity building to promote cultural inclusion and equity. So we develop practice guides and resources for the sector. And we also run training and workshops to promote inclusive practice. So we do work with the aged care sector to help raise awareness in how they can access interpreters, because that's been one of the issues. And I thought Tanina might be able to talk a little bit more about that, but it's been that there's been a underutilisation at times, or there's been confusion in how to access TIS, Translation and Interpreting Services, which is the main government-funded language provider. There's also been challenges in providers using family members or children of older people, but we really want to promote that consumer-directed care, that it really has to come from the client, from the older person, about what they want, and for it to be professional and non-biased. So that's some of the issues we've faced. So with the next slide, it is overseeing, obviously, the Partners in Culturally Appropriate Care program, which I mentioned before. So there is a PCAC provider in each state and territory. So the centre is the Victorian provider. So you can contact a provider in your state and territory to get advice around some of the resources that they might have to support culturally and linguistically diverse and faith diverse consumers in your state and territory. So if you go to the PCAC Alliance website, you'll be able to see the providers that you can contact. But you can always contact us and we can support you as well. Thank you, Andrea. So here is a bit of an overview on what you can find on our website. So our website is also funded by the Department of Health, and it is for a national audience. So if you go into there, you can see there's a section for consumers and carers, but there's also a section for service providers. So when you go there, you can see that there's a section on multilingual health and aged care information. And there's a range of topics that can help you support your clients to get information about the aged care sector. There's information on aged care services. So we know that My Aged Care, for example, has a range of translated resources. Whether they're the right translations, we don't know, but they have made an attempt there. Health and wellbeing topics. We've got topics around disability. Obviously, the NDIA have a lot of resources, elder abuse, community safety and financial issues. And then we have our community directories. So when you go to community directories, you'll be able to find some services and in language specific services to help some of your clients if need be. So we encourage you to have a look at our website and navigate yourself around the website. We also have a bilingual directory. So if you're looking for a person that speaks a specific language within the aged care sector, you can search for that within our bilingual directory as well, worker directory. So here's some examples of some multilingual information. So obviously My Aged Care, which I've mentioned before, have numerous resources and booklets regarding aged care services in many, many languages, which is very impressive how many languages that they've translated their information in, including Aboriginal and Torres Strait Islander languages. There's information about the Aged Care Quality and Safety Commission. and then a range of other topics, so such as advanced care planning, which has been a very, very big topic around the different ways that people understand their end-of-life care, and for example, you know, when people pass away, there's different rituals and different understandings and beliefs around death and dying. So they're really good resources. And things like specific health issues like arthritis or bowel health or incontinence is on there. And then we have also mental health and a range of other topics. So we just thought we'd just give you a little bit of a key insight into some of the topics there. And we're kind of like a hub where all the information on aged care is into this section, and there really is no other website like it. So hopefully you can utilise it. Thank you, Andrea. In terms of the multilingual resources that we provide at the centre, we've got our communication cards in 57 languages and our aged care signage in 57 languages, our consumer feedback forms in 12 languages, and our interpreter cards in 12 languages. But they're not our interpreter cards, they're the Victorian interpreter cards that we've placed on our website to make it easier to find those cards and more accessible. And those interpreter cards are simply for a consumer to print it out, or you can print it out, or someone can print it out. They can fold it, put it in their wallet. So whenever they go out, they show the service that they need that interpreter, and they're entitled to an interpreter. Our consumer feedback forms are to promote consumer voice within the aged care system, and to help consumers understand that they can give feedback to a service and they can read that feedback in language. That's because the aged care, government-funded aged care services are not funded for translations; they're only funded for interpreting. So not funded a lot for translation. So that's why we're trying to help out a little bit. Thanks, Andrea. And we've actually compiled some case studies for you to sort of have a bit of a feel around what it might look like for someone working as an interpreter in an aged care setting. So I'll pass it over to Tanina now. This is just to give you, to perhaps create some discussion points as well around some of the experiences you might have had or you might come across. So thank you.
Thanks, Lisa. Yeah, so as Lisa's pointed out, and also Eva, you know, we've been advocating for, you know, the use of language services in the aged care sector. It's been one of our core pillars across decades. And slowly, we have been able to get some traction with the use and the improved use of aged care, of interpreters in the aged care settings. However, we're still coming up with many challenges, and I thought it might be a good idea just to present a couple of case studies very briefly that might resonate with some of your own experiences, of course. Firstly, and we've drawn these from actual experiences that interpreters have talked to us about and prepared for us, in fact. So the first one is, for example, it's in an aged care facility setting where there's a care team meeting and a family meeting, and it's in the context of a care planning session, which involves, you know, going through the plan for a resident. So it might include treatment, diet, finances, all those sorts of things. And you've generally got a multidisciplinary team of professionals there. Now, in this case, it was a session that lasted 120 minutes, so extremely long session. And what the interpreter was finding was that she was having to switch between consecutive and simultaneous interpreting constantly. So there wasn't one clear mode of communication. And for her, she said it was extremely demanding cognitively for her to keep, first for the time frame and also for the, you know, this switching of modes. And the other dynamic here was that the family members didn't actually want everything interpreted. They wanted to have private conversations amongst themselves that, and were quite agitated when the interpreter was in fact interpreting everything and fulfilling their role in this context. So we asked her, you know, how did you deal with this situation? And she did say that she had tried to have a briefing with the healthcare team to find out what was going on and what would be covered. So she was able to make a quick mini glossary of terms for her to use as a reference during the meeting. And she found that she needed to make you know, and to do an introduction about the interpreter role and some of the protocols, and the fact that she was going to be interpreting everything, as, you know, if you like, setting the rules and clarifying the roles at the onset. See, what we've found quite a lot in the aged care setting is that because of the lack of experience that aged care providers have had generally with, especially in residential aged care facility settings, they may not be very familiar with the rules and the dynamics. And you might come across not only a staff member who's never worked with an interpreter before, but clients who've never ever worked with an interpreter or had access to interpreter services before, already in their 80s and 90s, after decades of being in Australia, and this might be the first time they've ever been in an interpreter situation. So that's a sort of dynamic you might be going into, and might resonate with some of your own experiences. So some of the issues there, you know, are really about how draining the whole experience can be for the interpreter, and also just not having the right supports from the people who are running the session, and that is the professionals, in terms of how they use the interpreter skill set, and what the expectations are on the interpreter. For example, not giving them enough time, or not giving them enough support, not managing the family dynamics around it as well, making it clear what is expected. So that was the first case study. If Andrew, if you want to move to the next one, it's sort of similar, except this is an aged care assessment context. And what we know from ACAS is that they are a lot more familiar with using interpreters. The ACAT teams, they in fact are much more proactive, and they have had a lot more experience in working with interpreters. I don't know if that's your experience. It's certainly from our perspective, whenever we've come across ACAS, they're much more on the front foot about it. So this is this is in a person's home where this ACAS assessment is taking place. And the dynamic here was that the loudspeaker actually was hard of hearing and wasn't wearing their hearing aid. So this was something that, you know, is going to impinge quite dramatically on the situation, the interpreter dynamic and the communication dynamic, if the person who needs to be hearing it isn't actually able to hear you. So again, some of the issues here are about the interpreter having to speak a lot more loudly and how draining that, you know, an assessment can take quite a long time as well, and it can be a drawn out thing. And in this case it was a he was saying that he found it quite onerous and burdensome, and the whole dynamics again about clarifying the rules and who should speak when. And, you know, it's almost like it's beyond our remit as interpreters to be able to set those rules, because we're not in control of the conversation, but then we're put in that situation where we need to set some boundaries around, you know, not talking over one another, keeping things simple, keeping things short, etc., etc. So, you know, and having to negotiate with a professional to intervene to make it easier for the interpreting situation to happen. So, you know, these are complex situations, and I'm sure you've come across many, many, many examples of this in the past. But what we're keen to hear about is, in terms of our advocacy to the sector, we need to hear these stories, the interpreter story, and be able to put it to the sector in terms of the sorts of issues that interpreters themselves are confronted with.
Thank you, Shanina and Lisa. And I think you've given us such a interesting overview of everything, and there's so much detail, yet so much simplicity in what you've said. So a lot of the stuff that we're talking about is so simple, yet no one's doing it. But where I was going to head with this is, you know, the kind of a little bit of an elephant in the room, and that is COVID, because we, particularly those that have family members that may have been in aged care, or I do some volunteering for Jewish care, and it was such a alienating experience, I think, for a lot of people, for families, for residents, for the elderly. But not having access to interpreters is yet another way of insulating people from their rights. I mean, would you just share a few words around that with us, maybe? Were you seeing particular trends, or what were people not just struggling with, but how were they overcoming those challenges? You know, so one of the things that I'm thinking of is maybe video interpreting or FaceTime or whatever. Are you seeing that coming through to your service?
So one of the things that we heard is that telephone interpreting or telehealth has been complicated for older people from culturally and linguistically diverse backgrounds. In the sense
We're
that
struggling hearing you a little bit. So sorry to interrupt. Thank you, Lisa.
Sorry.
That's better. Thank you.
One of the things that we've been hearing from the provider space is that during COVID, obviously a lot of services needed to be conducted via the phone or via telehealth, and with older people from culturally and linguistically diverse backgrounds, there is this thing called the digital divide, where people are not always able to access new sort of processes relating to accessing telehealth. Because sometimes with telehealth, they'll send you a SMS, or you've got to go into the website and log in and that kind of thing. So there were challenges in getting people to understand how to use the new services, older people. And then doing interpreting services over the phone had additional challenges around for people that might have had a disability, and for older people who might have had like dementia or other conditions. So that was one of the things that we've heard. I'm not sure, so it's something to be aware of around the challenges there. And the other thing we have been getting correspondence from another interpreting provider, government-supported interpreting provider, to say there's been an increase in demand for interpreting services during COVID. So obviously there's more need for language services during the COVID to translate information, to get those COVID updates. And so the Victorian government has created a new communication channel called the Cold Communities Task Force, where there's a WhatsApp group, and COVID-19 updates go through the community leaders and disseminated to the community and their families. And also the National Ethnic Media Broadcasting Commission, the NEMBC, also do podcasts of daily podcasting COVID-19 updates for all ages. But if we know that an older person has a mobile phone, they can get those updates via their mobile phone rather than having to access the internet. So there's been different creative ways to get information out to older people other than just interpreting services.
Right. And those creative solutions, that innovation is where we need to be focusing our attention, because I think there are lots of people being left behind. And I don't even think it's an issue of age necessarily, but, you know, like for me too, there's a lot of anxiety around using Zoom and, you know, the Zoom phase, or is this working? Can you hear me? All that stuff. And you can imagine that when you have a language barrier, when you have that digital divide barrier, that could be really, really problematic. Tonina, I was going to throw it to you. Have you seen, and being in the industry for quite some time, have you seen any creative solutions that you sort of went, wow, you know, how great of you, not anything particularly revolutionary, but maybe you could share something with us that you can think of, or am I putting you on the spot? I probably am, sorry.
Probably not with regard to interpreting and translating, unfortunately. I think that's actually it's been a huge issue. It's bad enough in normal circumstances to get, you know, people to use interpreters. In this case, I think that's fallen off the bandwagon quite a bit. It's just been all too hard. So I'm not sure what your interpreter pool, you know, what your interpreters are experiencing, but certainly from our perspective, I think it's suffered a lot, and the levels of isolation, you know, have just increased a lot for people. But certainly things like in aged care, particularly, you know, where they've tried to still maintain some sort of social interaction with people, say through glass windows and, you know, special pods that have been developed where people can still come in and communicate, but with partitions between them. You know, there's been all sorts of really interesting experiments, if you like. And we've been trying to highlight some of that good practice through our social media channels as well. Like we know, for example, one organisation that was teaching people to use their phones through their windows, like trying to bridge that digital divide through their, their windows at home. So I think there's been a lot of opportunity to do some really interesting things. But in terms of interpreting and translating, I've been dealing with that, the aged care from a personal perspective, the aged care sector, and I haven't seen a lot of really good practice, to be honest.
We're not particularly agile, over to you, Lisa. Yeah.
No, it's okay. I guess in terms of the aged care providers, what they've been doing to reduce language barriers, there is a service in the northern region of Melbourne who have a transcultural communication unit within their organisation where they have interpreters available 24, well, not 24/7. It is a hospital setting, but it's more, rather than outsourcing the interpreters, they've actually created a language hub.
Unit,
so I thought that was really interesting. And we also have other providers that have multilingual phone lines. So instead of having to call an interpreter for the consumer to call TIS and then call the provider, they can call the provider in language based on that line. So there's been some kind of movement, but it's still a long way to go. I think it's really important for the interpreters to know that when they go into the aged care settings, what kind of people they'll be coming across, what kind of languages and glossary of terms to be aware of, because there's lots of acronyms, there's lots of rhetoric, and it's always changing. The policy framework's changing, the new programs are changing. So we try to keep our website updated, and it's really because some words are not translatable as well. For example, dementia. It's different words in different cultures, and some cultures don't even believe in that dementia is an illness. For example, it might just be that the attitudes toward dementia might be that they're just getting old. So there's those kind of things. We know Dementia Australia has a lot of resources as well, but it's sort of just keeping updated around some of the key terms you might come up with in aged care, such as palliative care, end-of-life care, incontinence supports, or dementia support are the main ones. But then there's a range of other ones that come up as well. So I think that's what we recommend to be prepared for a meeting. And also with assessments, we're working with the assessors at the moment to potentially develop some kind of webinar which looks at some of the key terms in the assessment process. So we'll keep you updated, Eva.
Great.
If you wanted to run something like that.
And look, CCDA, or the Centre for Cultural Diversity in Aging, that both Lisa and Tonina are representing, is really an amazing organisation, and their website is full of really relevant and useful information. So we'll put that at the end of the webinar, but do check back in with the website because it's one that has information that's, like I said, very relevant to interpreters and translators and anybody that works in the aged care sector. But now I'm going to hand over to Marta, who's been waiting there patiently. And Marta's prepared a case study, again, to do with aged care, and one about signage and communication. And it's an interesting and also a bit controversial space, because what happens, and I think Tonina and Lisa will attest to it, is that people might reach to their phone or Google Translate or something like that when they communicate with people, and make it not a personal or particularly interactive exchange. So these signage and communication cards have a particular purpose for which they were developed with CCDA. Marta, over to you. Tell us more about that particular case study, please.
First of all, thank you, Eva, for inviting me to this webinar. Hello, everybody. Today I will be talking about the aged care project for Center for Cultural Diversity in Aging, which we had the pleasure to work on. And I will shortly talk about the project details and the process of the production. I will be presenting as well how we communicate our project to our vendors and how we are delivering a good quality project to our clients. Center for Cultural Diversity in Aging came to us with a wonderful idea to create signage and communication cards, as Eva said, to assist the communication between staff and residents with low levels of English in aged care facilities. So signage cards are used to assist people with directions and emergency instructions, while communication cards are used to help staff better care for residents and give these residents more to say about the care they receive. So this project was done in two parts. First one was for 22 languages, and the second part was for 35 languages. So in total, we translated these cards into 57 languages. So it's very impressive. So those cards were translated into standard languages, such as Chinese, Vietnamese, Italian, Arabic, Greek, but also in some rare languages, such as Amharic, Chaldean, Nepali, Oromo, or Tetum. So also, in addition to translation, we also completed typesetting to this project. So typesetting is a process of inserting completed translation into the final design files, and we are using InDesign software. It's Adobe product. So this project was typeset into 3,363 pages. So yeah, it was a big job. So yes, please turn the next slide. So I'm going to talk more about the project preparation. So always at the beginning of every project, we also always review the source file, which we receive from our clients to make sure that we understand them correctly, and we know what's the objective of the project. So thanks to clear instructions provided by Center for Cultural Diversity in Aging, we knew what's the purpose of the cards and who will be the target audience as well. And knowing that, we were prepared to produce the brief for our vendors. So it was very important in the preparation process. So yeah, please next slide. So yeah, we are at the beginning of the communication with our vendors. We always create bilingual templates for our vendors, especially when there is a typesetting involved. Then we are writing a brief for them based on the source documents provided by customer. Yeah, so translators basically know what is this project about and how to translate the source in English. So as you see on the left side of the screen, there is a bilingual template. So basically is the Word document with tables, and each row has a sentence or section to translate. So in case of signage and communication cards, we had listed one word per row. We also provide instructions in comments in this file. For example, we are keeping this like for vendors to keep the same format as in the source file, or keep yellow highlighted words in English like numbers or names of the company. And also sometimes we are asking our vendors to use the same terminology or the same way of translation as a previous, like it was used in the previous projects. So we can keep like to stay consistent with our translation. So yeah, bilingual template is the one of the communication process, but also at the right side of the screen, you can see the project brief. So we also send it to our vendors. And this brief is basically a table form with information about the deadline of the translation, target language, the type of translation, or any additional information for translators. So yeah, when we receive the translation, we always followed up the we check internally if the vendors followed our instructions, and we can check if everything is fine. Yeah, so the last but not least, I will talk about the how we assure a good quality translations at Polaron. So for this project, we try to find translators who had an experience in HK translations. So it's very important to try to find someone who was experienced in that. Also, once we receive translations, we are doing internal checking to make sure that all formatting is correct and nothing is missing. Also, after receiving typeset files from our DTP specialists, we are always sending these files to translators once again for a final review, just to make sure that everything was implemented correctly. And when everything is finalized, we are preparing the package to send to the customer with all the files. And this common package may consist of bilingual templates in Word and PDF format, and also in design files at the end. So yeah, this is all from my point from a project coordinator point of view. So I will pass on the presentation to Gabi.
Yeah, and before we do that, well, thank you first, Marta, for explaining what happens behind the scenes. And just like Janina and Lisa were explaining, I guess Janina in particular, how important it is to brief interpreters. Yeah. It's even more important to brief translators. So for a project that Marta just showed you, let me just explain to you what it really means. So she's this very calm and organized person, but what actually happens is that she would have worked with probably around 150 people to deliver those 57 languages, 3,336 pages, whatever. Yeah. It is a massive undertaking. And if you think about the level of detail and what you have to do to produce this beautifully looking cards, it really is quite a feat. And the reason we said there that we do appreciate feedback is this, that language is something that people think they own. You know, so I happen to speak Polish and I know best how to say things in Polish, but we do encourage it because we hope that through the process of feedback, we're going to end up with better information for the end user. So at the end of every one of this card, there's an aged person, a senior, an elderly person in an aged care facility somewhere that needs this, right? So we always think of it in those terms, remembering that it'll be of use to somebody that can't communicate in any other way. And this is not to replace interpreters. This is not to replace, you know, family visits or whatever it is that we surround our elderly with. It is to assist. So Marta, I do have a question. What would you say is the biggest challenge, apart from coordinating 150 people? Like, what would you say in your work, what's the most difficult bit and how do you overcome it more to the point?
Yeah, so I think because it was like the first of my like the first project, I can say, when I came here to Polaron. So this was pretty challenging, and yeah, those 57 languages to coordinate with all the vendors and between translators and between our DTP specialists, just to coordinate all these processes. So I think that was the most challenging thing for me.
Thank you, Marta. So if you are wondering how much value you should put to one word, this is how much value you should put to one word. So you might get a card with one little word that means breakfast, but behind the scenes, oh my goodness. But you know what? None of this would happen without our wonderful translators. So I'm going to hand over to Gabby, who is someone that we've worked with for a long time, just to give you an idea of what kinds of things she considers when she looks at a brief. So as you can see, we're taking you through the journey from start to finish of an idea in a client's head, then the execution through a project manager, someone like Marta, and then over to the translator without whom nothing would ever happen. So Gabby, what happens at your end?
Hi everyone, thank you, Eva. I'm happy to be here with you again. And yes, I'm Gabriela Lefebvre. I'm a Spanish translator, graduated in Argentina with over 25 years in the industry, even a bit more, and that's a lot. Today, I would like to briefly share my background with you, and then I will talk about the experience I've had with the translations for aged care. During my career as a translator, I have completed work in many different fields, such as veterinary, medicine, legal, technical, migration. I have even translated love letters. So as you can see, I am very versatile. I've had the pleasure of working with Polaron, Eva, and the team for the last 16 years or so. I even presented a paper in one of the translation conferences in Melbourne a while back in 2004. So, well, let's go to the first slide. In the translation process, there are many different steps, and they are quite interesting, and there's a lot of research involved. We rely on glossaries, terminology, reference materials, dictionaries, and I'm sure my colleagues would agree with me. There are also many challenges in a translation, and I will briefly mention 3 today. So the first one is that when we prepare a translation in general, but I will refer to aged care today, we try to have the terminology translated for everyday language. Sometimes we need to translate a brochure for general information so that people from different backgrounds or who are not very proficient in English can't understand it. And in some other cases, we also translate for doctors, laboratory technicians, or people with a medical background. In that case, our language needs to be of a higher or more technical register. However, and I would say 80–90% of the material we translate for aged care is prepared by the health industry. In some cases, they can have medical terminology expressed in medical terms, which we need to respect and convey to be faithful to the source. In some other cases, this material could be written in a simple or plain language, and of course, we would need to convey it as well. So either case, we need to respect the tone used by the original text and convey it in the target language. Unfortunately, on some occasions, we receive material poorly written, which makes our jobs even more difficult. Maybe we can work together in this aspect as well. Is this something for people writing brochures, questionnaires to address? Not long ago, I did a research on the way people, older people if you want, like to read medical material or like to hear medical information. Overall, the result is that they prefer plain language. So perhaps as translators, we need to work a bit more with the health industry so we can write information that is easy to understand. There are many government agencies that are already doing this. So in saying so, I do agree that some terminology should not be sugar-coated. A cancer is a cancer, and it needs a proper name for it. However, some types of cancers admit treatment better than others, although their names may sound terrifying. But the patient needs to know that, the patient or the reader. I'm using the example of cancer here, but we can talk about diabetes, Alzheimer's. In my opinion, I have consulted this with a psychologist. The patient needs to know exactly the name of the disease or condition, if you like, in its proper description. However, sometimes they prefer to know they have high blood pressure instead of hypertension, which could be confusing or scary. Yes, medical terms could be scary. So the patient wants to be informed, clarify doubts, and acquire some certainties, and it is on those certainties where their capacities are supported to face the situation. Will I be right or not? Perhaps that's something to discuss with the health industry as well. We also have to bear in mind that in some cases we are translating material for people with different cognitive capacities, and we really don't know who is going to read our translations. So we could say that we need to be careful in the way we translate or convey the information. What we must not do is to change the meaning or the way in which the original text is written. And again, if it says high blood pressure, we will need to translate exactly that. Sometimes in Spanish, as opposed to the term in English, the proper colloquial translation, or the one for everyday language, is not the simple word used in English. For instance, blood sugar has a more medical translation rather than blood sugar. The correct term would be glucemia in Spanish and not azúcar en sangre. That is in Spanish, by the way, as we've seen it so many times. And doctors, perhaps due to the English influence, use these words. Next slide, please. The second challenge, and a particularly important one, and I guess that we face it in our everyday work, is that here in Australia, there are people coming from different countries. And Spanish is spoken in 18 countries, 18 different countries in the world. However, the language characteristics vary from country to country. So we need to use a neutral language, or try to use a neutral language, as the same word may mean something totally different in each place. For instance, I may say that in my everyday practice, I make consultations with people from different countries, including doctors or people in the health industry, to double check that the terms we may find in the dictionaries are those actually used in the everyday language. Our aim should always be to convey the message in the easiest way to be understood by the target audience. For instance, patients and their carers who may not have the same background as the patient. Also, some government agencies have terminology glossaries on their website, as Lisa has mentioned, but perhaps older people are not interested in checking them. So they need information right there, easy to understand. Some other people prefer to ask Google, or even worse, have a Google translation, and there is where the problems lie. I have found that there is a lot of terminology in the literature that people who do not have a medical knowledge may not understand easily. So they can go online, check the terminology, even find an explanation of what the term means. Next, please. The third and the last challenge, and I would like to raise today, is that, as you may know, languages change all the time. For instance, the usage of some of the terms has changed. And as translators, we need to be very careful about the way we refer to people, and we need to use broader terms and try not to make any difference regarding gender. For instance, the word nurse in English is short and refers to any gender. So there is no problem. However, in Spanish, there is a word for a female nurse and another one for a male nurse. So therefore, the sentence becomes longer because both of them must be included. So that is the reason why nowadays we try to use the equivalent to nursing staff. So it is gender neutral. This is an important movement in the Spanish language, and linguists, translators, users are still trying to agree on it. Not long ago, we're referring to an elder person. It was politically correct to use the equivalent to third age. Currently, we are using the equivalent to older adults. These changes need to be reflected in the newer translations, in the terminology we use, and in the way we address people in general. So again, I guess we will need to use broader terms when translating, which is quite challenging because, as I said before, people from different countries use different terminology. So it's also a big issue to translate for people that may arrive into the country 40 years ago, perhaps, and they are not aware of these changes in the language. So in some other cases, some words may not have been accepted some years ago, and now they are. Next, please. So my top tips would be: use medical terminology in the easiest way to be understood, use broader terms, write material in a simple or plain language, and to think about translators should work with a healthy industry so we can achieve easy to read materials. So to summarize, our task as translators is not as simple as people might think. It involves a lot of different approaches that must be taken into account at the time of starting to translate. So
thank you, Gabby. That was a great summary and a really good insight into what you do and some of the challenging aspects of your job. So the other thing I just wanted to briefly add to that is that, for example, in English, in the mainstream, we do not use certain words anymore. So we don't say suffering from dementia.
Exactly.
We do not say disabled person. So we found ways of, and language really does matter. So what I wanted to do now is open up for discussion. We've got a lot of questions. So I'll hand over to Andrea, and hopefully we can generate a bit of interesting discussion there.
All right, guys, thank you so much for such a wonderful presentation from all of you. So I wanted to know a little bit about the challenges. We know from Marta's that's been a lot of challenges from the project coordinator's perspective, but what about from the client's perspective, from Tonina and Lisa? What were those some of those challenges that you encounter when I'm referring to the project that Marta presented about the cue cards.
I'm happy to answer that because this project has taken it's a long time frame. It's not just all done at once. Look, from our perspective, I don't think we could have chosen a more collaborative partner. It's just been a really easy transitional project, because it was very clear. We've tried to make it very clear what our objectives are, like Marta said, and really Polaron just were able to take it the baton and run with it. So from my perspective, there have been no challenges. Our challenge has been just getting trying to lobby the government to give us more money to do more translations. the cards, particularly the communication cards, are the most popular download from our website.
Wow.
Bar none. Yeah. So in their very simplistic format that they are, they certainly hit the mark with something in the sector. So that's why we've reinvested in it.
Wonderful. Lisa, did you want to add something to what Tanina's just said?
Yeah, I agree with Tanina in the sense that it's been a great project to work with Polaron on, and especially now with the addition of 20 new languages. So now we have 57 in those 20 new languages that were done so professionally, and so it looks very easy from our point of view. But then now hearing from Marta, my God, I was like, I can't believe this has happened. Like 150 people have to be coordinated and 3,000. Oh, so sorry. But anyway, it did happen, and it was just a lovely experience. But in terms of the consumer's point of view, we are getting feedback from providers around them wanting more sentence-based communication cards rather than one-word cards. Additional words such as I'm thirsty or I'm hungry, things around their needs and feelings, and requesting for supports around personal care or medication. So, like Tanina said, we need to have a third phase of the project, which is looking at perhaps speaking to the providers and consumers around what additional words might be needed. And the other challenge is for them accessing the communication cards. So at this point, it's almost like they are targeted towards the providers to print out the cards, laminate them and put them as a resource in residential care facilities or in their aged care settings. But for consumers to also access the cards, that's probably tricky because they're only available on our website. The other thing I wanted to mention is the Cold Assist app. So the Cold Assist app is available on Android and iPhones, and it's a free app run by the CSIRO and Western Health. And that is that's where it's similar to our communication cards, but it's targeted toward hospital settings. So it's for nursing and speech pathologists and medical staff. But some of the words and sentences can be transferred into aged care settings. So I'd encourage you to check out the Cold Assist app as well. There's over thousands of different words there, and I'm not sure how many languages they've got there, but it's a very expensive project. But I think it's worth checking out as well.
We might have to ask Western Health to come and tell us all about it next time. But I think the other point, of course, we all want to make is that the cards are not to replace interpreters. They're not to replace, I guess, communication in crisis or, types of exchanges where, a face-to-face interpreter is required. But they do provide connection and also show care. And I think when so much work has gone into a resource, clearly that's because we all care, right? I think you wanted to add something, Lisa, there, yeah?
Oh, no, I was just going to say that the Cold Assist app team also mentioned that it's not replacing interpreters. Right. However, there are situations where someone just needs to communicate in that instance. So you're not going to call an interpreter to say, are you in pain? Right. And unfortunately, our research has also indicated that there are a lot of people that have language needs or speak a language other than English in an aged care facility, and sometimes they're the only person in that aged care facility, or there's 2 or 3 people within a larger group. So imagine being the only person in an aged care facility that doesn't understand English, how isolating that would be.
Right.
So just to be aware that that's what we found in our research. And then there's obviously ethno-specific or cultural-specific aged care facilities where everyone speaks that one language, but not everyone goes to those facilities. So yeah, these are some of the challenges facing our consumers in aged care. But we're always open to hearing from interpreters because they're obviously at the coalface working with consumers, to always open to learning new stories, new case studies, because that's how we can then advocate up to the department for extra language support as well.
Of course, and there's time and place for everything, and these cue cards and any resources that are available are to serve a certain function. And I think it's as Gabby said, it's one thing that's missing really from the industry is that collaboration so we're seeing people potentially wanting to develop resources that already exist somewhere else, or if it's a good example of good practice, we should be promoting that, which is what we're trying to do today. But guess what, everybody, we have run out of time. there's like a million questions that I'm not even exaggerating that people have. So we will address them in a thank you message that we'll send you afterwards. But Lisa, Tanina, Gabby and Marta, thank you so much. And also Andrea, as always, from behind the scenes for making it all happen. It's been a very, very popular webinar, so we are going to put it on YouTube and all over the place, so that if people want to listen, they can and they should. But I think if anyone has questions, Tanina and Lisa are very approachable. So is Marta, so is Gabby. Me, not so much. No, I am. But can I just say thank you for sharing your knowledge? And you know, it's a big topic, and there's much more that we could say. But I'll just hand over maybe to Lisa just to say a few words that you want to say, and anybody wants to reach out, feel free to.
Absolutely. And I just want to say thank you again for inviting the Centre to this webinar. It is an important topic. We know that the aged care sector is changing and evolving, has been greatly impacted by COVID. Every single interpreter and translator is important in the journey to human rights and for people to be able to express themselves naturally. Please reach out to us via www.culturaldiversity.com.au. There's lots of information there. So, or just email us at info@culturaldiversity.com.au. Thank you, Eva.
No, you guys have been amazing. Thank you, every single one of you, and have a great afternoon. Okay, thanks.
Thank you.
Bye.
See ya.